It's a pleasure to be here with you this morning. I'm Steve Johnson. I'm the Vice President of Government, Community, and Legislative Affairs here at Owensboro Health, and I have the esteemed pleasure of working with a tremendous group of individuals that makes this possible, and certainly my appreciation to Debbie Zerner and the team that helps to put this together. You know, it's always an exciting day when we get to announce Owensboro Health's annual Community Health Investment Grant Award recipients. You know, our mission here at Owensboro Health is to heal the sick and improve the health of the communities we serve. Well, we can't do that without you. It's a responsibility to this mission that's even more important, particularly in wake of COVID-19 and the global pandemic. So like never before, the last few months, they've really solidified the importance of all of us working together. And I'm certainly very proud to be part of an organization and a team and a community and a region that doesn't just come together for situations like this, but we stay together during these most challenging times. So my thanks and appreciation to all the organizations that are going to be recognized today, but then also to all those individuals and organizations that may not be grant recipients that are working together to advance better health and quality of life in our region. I want to thank also the board members of Owensboro Health who actually approve each one of these grants. They look through the grants and they approve those before it even gets to this point. And it does require commitment, dedication, a lot of mornings and evenings, and a service with absolutely no financial compensation. So we certainly do appreciate that. But they do so for the mission that was mentioned before and to be a part of days like today. You know, no announcements and no awards would be possible without their dedicated service. And most appreciative of each of their service and their sacrifice. And I'd be remiss if I didn't offer my special thanks to Vicki Stogsdal, who's a member of the Owensboro Health Board of Directors, and she's also chair of the Community Needs and Strategic Planning Committee, which is the board committee that looks over all of these applications prior to it being approved and going to the formal board for its vote. So thanks to Vicki as well. So all proposed projects, they were required to address community health needs identified in our local community health needs assessment. And each organization made a firm commitment to having a comprehensive tobacco-free policy prior to their application submission. Special consideration were given to projects which address one or more of our 4 priority focus areas. Those are older adults and aging, tobacco and related diseases, children and school health, and arts and healing. The selection and allocation of these funds has involved tremendous work, dedication, and passion by many Owensboro Health team members and countless hours of application review and discussions. We're so appreciative for the work that these team members put forth to get us to this point today. These team members work diligently to review grant requests and meet as many needs as financially possible during that period of time. It's a challenging task, and it was extremely even more challenging in wake of COVID-19. So it's now my pleasure to introduce Owensboro Health's President and CEO, Mr. Greg Strahan, who will further discuss this year's awards.
It's a pleasure to welcome you on this very special day. On behalf of the entire Owensboro Health family, a heartfelt thanks and appreciation for all of the outpouring support that has been given to Owensboro Health and the entire healthcare community during this unprecedented time. Every prayer, every good wish that was directed our way was heartfelt. Through events like the driving prayer vigil a few months ago, or the donation of PPE and hand-sewn masks from local businesses and volunteers. They are all heroes just doing what they do best, not just during the pandemic, but during every circumstance that comes our way. Healthcare is a service business, and we are here to serve others. And so it is with all the grant recipients recognized here today. Together, we are all here because of our service to others. We've seen a lot of highs and lows, ups and downs in a person and family member's life during my 35-year career in healthcare. Nowhere else has this been more evident than over the last 5 months with the global pandemic. All who have been impacted, both personally and professionally in so many ways, have demonstrated resolve, compassion, and resilience in dealing with the situation. All came together as partners in serving the needs of the community and region. In this most challenging times, all came together to make our lives, our loved ones, our family members, and complete strangers a little bit better. Thank you for allowing Owensboro Health to partner with you in this service. You take care of us, and we take care of you, and collectively we can take care of each other. Of all the things we do at Owensboro Health, none can be more important than partnering with the communities and the people we serve, and who serve others. At no time has this been more evident than during the current global pandemic. Today's announcement marked the beginning of what we refer to as Owensboro Health Season of Giving. The Community Health Investment Grant Program is only one way Owensboro Health makes direct community investments to impact the health of the communities we serve. In October, Owensboro Health will kick off the annual OH Gives employee campaign. Last year, Owensboro Health team members pledged almost $250,000 to regional United Way and health-related organizations as part of the OH Gives campaign. Owensboro Health, as an organization, matched those team member pledges at 50 cents for each dollar donated, resulting in almost $400,000 in contributions. This campaign also provides support to many of the charitable programs of the Owensboro Health Foundation, the philanthropic subsidiary of Owensboro Health. The foundation directs special events, fundraising campaigns, and seeks grants funding to assist Owensboro Health in implementing and sustaining health initiatives that are having a positive impact in our community. Unfortunately, due to the abundance of caution, the Owensboro Health Foundation annual golf tournament and annual gala had to be canceled. Support being offered by Owensboro Health Foundation has not stopped and has actually increased to address the needs of those impacted most by COVID-19. We are extremely appreciative of the individuals and organizations that partner with Owensboro Health Foundation by volunteering and making tax-deductible financial contributions to assist in our work. In November, we'll begin to conduct our annual holiday food drive. Last year, our team members donated over $22,000 in cash and provided 19,835 pounds of food to the Help Office of Owensboro and Hope to All food banks. Tremendous contribution. With Owensboro Health continuing to grow and expand regionally, the impact of this compassion and generosity by team members will even be greater. I'm extremely thankful to all the Owensboro Health team members who have contributed to the success of this effort and will continue to make our community health investments and giving back who we really are. We provide quality and compassionate care to our patients. That's what we do. Giving is something Owensboro Health and our team members are committed to year-round. Taking care of our patients extends beyond our facilities and into the broader community and region. Owensboro Health invests in programs, projects, and organizations because healing the sick and improving the health of the communities we serve is our job, and it's also our love. Owensboro Health cares about the health of the communities we serve, but it takes organizations like yours realizing the needs that exist and taking action to create positive change. By doing so, together we will impact the overall health, well-being, and quality of life for our neighbors, our family, our friends, our members, our employees, and certainly our citizens. The projects being recognized today are but one way we can partner to make a difference in our region. These projects will address access to care, including programs addressing mental health and dental health, which we so desperately need in our communities. Some grants will address obesity, tobacco cessation, food insecurity, literacy, and arts and health. Others will address substance abuse and adverse childhood experiences. Additional projects will address one or more indicators, including those who will focus on suicide prevention, education, and social determinants of health, such as poverty, education, the economy, prevention, and safety. Many of the grant projects are addressing one or more of our hospital priority focus areas. In total, I am pleased to announce that Owensboro Health is again this year awarding over $600,000 to our community partners. To be more specific, 35 community agencies and their projects will be the recipients of over $640,000. Owensboro Health Director of Community Engagement, Debbie Zerner, will be reading the name of the recipients with a short description of the project. Thanks again for your partnership with Owensboro Health in working to improve the health of our communities.
Well, welcome. It's not our normal venue that we come together to make these wonderful announcements with you all, but it's through a virtual event, and we appreciate you so much taking your time to be with us as we make these announcements. And for all of you who are watching, just appreciate you so much taking a moment out of your day to join us in this special occasion. Usually I share a story with you, do some housekeeping things, but today I just want to say a heartfelt thanks to all of you, our organizations who are grantees, and also who are our partners. Many partnerships are formed with Owensboro Health that are outside the grant program, including those partnerships with our marketing and sponsorships, as well as other partnerships that we have, and we'll talk about those as I make these announcements with the grantee's name and a little bit about the project. But first, if you'll let me, I'd just like to share a little something I found from a book dated 1955, How to Have Better Health Through Prayer. Because when I read this piece, it reminded me of all of you all, the organizations and the agencies who help Owensboro improve the health of the communities we serve. And as our CEO, Greg Strahan, said earlier, we can't do it without you. You touch people in a way and reach our communities that we may not be able to reach, but you are out there every day. This particular piece is called Put Out Your Light. On a dark street, there was a little light bulb shining on a small sign. The sign said, "Welcome, friend. Come in any time and chat with me, Carl." A stranger who felt alone and neglected saw the sign and went in. He walked down a narrow alley and saw a small side door. Over the door was another tiny light. In a room off the hall was a middle-aged man, terribly crippled with arthritis. The stranger knocked. "Come in, friend, come in," said Carl. "I see you saw my friend maker. That's what I call my little light. You can see how bad I have arthritis. It's incurable, too. I can only sleep a little bit at a time. Well, there's lots of lonely folks out there on the street at night, folks with no place to go and no one to talk to, folks with lots of troubles like me. I know those lonesome and suffering folks would like to talk late at night just as much as I like to talk and listen. So I put that sign out there. I wanted to share this with you because each of you have your own sign in your organizations and your agencies. And you put that sign out there, and our community citizens, they know where to go. And when they don't know where to go, you're working together diligently, passionately, arduously, to make sure that people have a place to go and someone to talk to. And you make sure that they're fed. You make sure that they're fed not only with food they eat, but spiritually and physically and artistically and culturally. That's you all. You put the light, and we at Owensboro Health are privileged to be your partner in that. And through the Owensboro Health Community Health Investment Grant Program, it gives us an opportunity to make these investments in you who have your light on 365 days a year, 24 hours a day, and we couldn't be more proud to partner with you. So if you will, I would like to take just a little bit of time to introduce our FY, fiscal year 21, grantees. And, when we come together, I do this, and I still want to be able to do this virtually, is announce the name, but a little bit about what that project does, because I think that's very helpful for us, and I think it's very helpful for you all. And as this is going to be seen by many people, I think it's very helpful to know what investments Owensboro Health is making in these organizations and why, what impact they're making and to whom. So we'll start with the Bluegrass Music Hall of Fame Museum. The name of the project is Improving Health and Wellness Through Bluegrass Music Programming. This is their bluegrass community outreach in the schools, Saturday lessons, community engagement, music outreach, and bluegrass band project. CareNet of Owensboro, obstetrical ultrasound program expansion. The expansion of the obstetrical ultrasound program by adding an additional ultrasound machine and exam table. Expansion ensures that more pregnant mothers receive care, information, and education at an earlier point in their pregnancy, thereby achieving the goal of healthier, full-term pregnancies delivered by healthier mothers. CASA of the Ohio Valley, Change a Child's Story. Community awareness program related to child abuse and resilience factors in the spring of 2021 to address the behavioral health needs of children in the court system. Grant funds will be also used to increase community awareness engagement with an active campaign in print, video, and social media outlets. Cliffhaven Boys and Girls Club, Bountiful Kids, cooking classes for 20 youth, swimming lessons for 40 youth, teen night at the Mike Horn unit to include tobacco and vaping education, and Western Kentucky University Challenge course. Community Dental Clinic, Dental Healthcare Education and Access to Care Project. The target population is the uninsured and Medicaid patients in our area who need routine and emergent dental care through their Charity Care Fund. This project also involves helping to pay for staff PPE against COVID-19 transmission. Daniel Patino Shelter, the HEART Program. Funding recommended for specific components of the HEART program include conscious discipline education and training, equipment to support play, social, and emotional learning, and evidence-based programming to commit assisting their staff and residents with tobacco cessation interventions and resources, and becoming the first Davis County homeless shelter to adopt and implement tobacco-free policy. Davis County Diabetes Coalition, reducing chronic disease, increasing resiliency. Care Direct is a self-measured blood pressure management initiative. Program components include education, support, supplies. An Omron blood pressure cuff is provided to participants and is theirs to keep upon successful completion of the 6-month program. An additional 6 months of education, enhanced management, is available if desired. The pharmacy, and that's with an F, F-A-R-M-A-C-Y, the pharmacy program allowing for increased access and availability of fresh fruits and access at the farmers market. Davis County Public Schools. The Umbrella Project, Rise Up for Resilience. The Umbrella Project, Rise Up for Resilience, promotes development of positive mental health and reduces stigma that is so often attached to mental health. Funding supports the Rise Up for Resilience Summit, Safe Spaces, and Mindful Rooms. Girls Incorporated of Davis County, Healthy Living 2020 and Beyond. The goal of Healthy Living 2020 and Beyond is for girls to participate in and use educational activities, resources, and opportunities to promote strong, informed minds, to encourage lifelong smart choices, and to build bold habits that lead to healthier futures. Greater Owensboro Young Life, Lead Through Mentoring. The mentoring program is to address the need for identification, the need to belong, a lack of purpose, detrimental family impacts, and negative peer pressure, many of the root causes that adversely affect our high school and middle school students. Green River District Health Department Nicotine Reduction Program, the Green River Nicotine Reduction Program. Continued work to provide nicotine replacement therapy, the tobacco quit line, and cessation support education, and awareness regarding Juuls and electronic cigarettes. partnership is a model in the state, and they have been asked to share this nationally for replication. This is a partnership with Owensboro Health and Green River District Health Department that has made significant impact on tobacco usage in our region, and one that we are proud of, but obviously the state is looking to replicate this nationally, so that's pretty exciting. Green River District Health Department DC CAP, Davis County Community Access Project. This program provides prescription assistance and access to care reaching at-risk vulnerable populations. Their goal this year is to provide at least $3 million in donated prescriptions to our local community, and they have met their goals annually, and so proud to partner with DC CAP. Green River District Health Department Safe Sleep for Babies. The project Safe Sleep for Babies is to purchase 50 safe sleep survival kits. These kits consist of the following: sleep sack, pack and play, fitted sheet with safe sleep messaging, soothing pacifier, and a Sleep Baby Safe and Snug children's book. The Hancock County Partners Coalition, Tobacco, E-cigarette prevention, education, and cessation. Youth and adult education about the dangers of tobacco and e-cigarette use, and to decrease usage rates among youth in Hancock County, Kentucky, and Spencer County in Indiana. Components will include prevention and diversion, education, and cessation. Hospice and Palliative Care of Western Kentucky. The Hospice and Palliative Care Triple Aim Initiative. This funding will provide for components of the Triple Aim Initiative, providing education on the benefits of receiving the right care at the right time in the right place. There are training components to this, EMR, and certifications for staff, and as well as the Camp Courage for Children are all part of the funding to hospice and palliative care. Junior Achievement of Western Kentucky. JA Pathways Toward Career and Life Success for K through 12 Youth. This investment targets youth in 11 counties in the highest free and reduced lunch classrooms, providing students with the knowledge, skills, and tools to increase understanding of importance of improving their economic well-being. Kentucky Kids on the Block, a new grantee this year. Puppetry Programs for Good Health. This new applicant will be providing educational puppetry programs addressing priority health needs at public elementary schools in Butler, Hopkins, and Ohio counties. Light of Chance, the Breathe Youth Arts Resiliency Program. This program seeks to improve adolescents' mental and behavioral health through the use of the Breathe Youth Arts Residency Program, called BYARP, as a 31-week pilot initiative implemented in the Hopkins County Day Treatment Program. This is a holistic program comprised of distinct yet interconnected service components, including the visual arts, music, creative writing, performing arts, and mindfulness exercises, which help participants learn skills and promote cognitive focus, emotional regulation, and decision-making. Marcia's Place Resource Center. The project is Marcia's Place STI Clinic. The STI Clinic at Marcia's Place in Henderson involves multiple counties, will increase access to health and increase the health of our community by providing education and free STI testing and treatment to vulnerable clients. Muhlenberg County Public Libraries Story Walk. This may sound familiar because last year we had a grantee in Davis County who did the Story Walk, and if you haven't taken advantage of that, I encourage you to do so. The Muhlenberg County Public Libraries will place story walks at Lou Ray Park and Rails to Trails in Muhlenberg County. Story walks encourage reading and physical exercise in an outdoor setting. New Beginnings Sexual Assault Support Services, EMDR Integrative Attachment Trauma Protocol for Children. EMDR training to help children with severe behaviors and developmental trauma develop healthier attachments, self-regulation, and work through their trauma. Owensboro Dance Theater, Dance for Wellness 2021. The Dance for Wellness project focuses on 4 programs: Rising Stars, Adaptive Needs Dance Therapy Program, Dance Movement Lean Program, Dance for Health, and a new component, Dance to Learn Science. Owensboro Museum of Science and History. Discover Owensboro, Discover World, and Davis County Health. Discover Owensboro and Discover the World science and general learning programs to assist students with science and math literacy and construction of additional health exhibits. The museum is considering the construction of the Davis County Health temporary and permanent history exhibits. They are also partnering with the Owensboro Innovation Academy. Owensboro Public Schools Health EX Education Project. Owensboro Health School's Allied Health course prepares high school students for a variety of healthcare careers. Owensboro Regional Suicide Prevention Coalition. Community, business, and professional awareness campaign. Strategies supported by the Kentucky Suicide Prevention Plan and the National Strategy for Suicide Prevention, including community-based programs aimed at reducing stigma associated with seeking treatment for mental health problems, utilizing educational materials and programs designed to help people understand suicidal risk and warning signs, increase the competency of those professionals who work with patients who are contemplating suicide, and provide support to loss of survivors. Owensboro Symphony Orchestra, Music on Call. Music on Call brings meaningful musical experiences directly to participants in their environment through a variety of community partnerships. Funds will cover artistic expenses, technical expenses, and staging and property expenses. Puzzle Pieces. Healthy Play, Combating Obesity with Those with Disabilities. Funding is for the first phase of our project, Healthy Play, Combating Obesity in Those with Disabilities. The first ever outdoor sensory museum installation of an inclusive playground. Puzzle Pieces will be a national test pilot site. Phase 2 has multiple committed partners, including the Christopher Reeves Foundation. River Park Center, Broadway 2020, 2021, and Pay What You Can. The Pay What You Can program underwrites free and greatly reduced tickets for Broadway shows and other River Park Center performances for those who may not otherwise be able to afford attending those and have access to those programs. Senior Community Center of Owensboro, Davis County, the Frozen Meal Project. Funding will support continuation for the Senior Frozen Meal Project, creation of an instructional manual for others to replicate, and identification of alternative funding sources and partnerships that will create program sustainability. And I'm very pleased to say that this program, in partnership with Morrison's, Owensboro Health, and the Senior Community Center, had served pre-COVID over 12,000 meals, and since COVID, that program has continued and has served another 12,000 meals. So again, addressing food insecurity in our community. Susan G. Komen, Evansville Tri-State Affiliate, Saving Lives in Western Kentucky. Funding will support pilot project to address social determinants of health to reduce burdens on non-medical expenses to patients with breast cancer. The Foundation for Excellence at Owensboro Public Schools. Owensboro High School's Biomedical Expansion Project. Funding will assist to equip the Biomedical Pathway program for Year 2 class and laboratory needs. The Salvation Army. Summer SOAR, S-O-A-R, Schools Out Activities and Recreation Project. Some support will be given for the 2021 Summer SOAR Children's Camp Program. The Way of Rockport, Healthy Living for 2021. Funding allocated will support provision of dental care for clients in recovery in this Spencer County Recovery Facility. Theater Workshop of Owensboro, Spotlight on Kids. Funds will provide support for youth productions, in-school educational programming, drama camp and clubs, educational workshops, and their in-house school day performances. Tri-State Food Bank Capacity Expansion Project. The goal of the Capacity Expansion Project is to greatly increase the physical capacity of Tri-State Food Bank, enabling it to double the amount of nutritious food distributed to the hungry and effectively take the food insecurity rate to 0 by the year 2030. This project aims to reduce food insecurity and provide nutritious food to the needy and especially to the most vulnerable populations, children, senior citizens, and those living in food deserts and rural communities. And I will say during COVID, COVID-19, the past few months, Tri-State Food Bank has worked with multiple community partners throughout our region to really help to assist to address the food insecurity no, it's not even a problem. This is a very serious social determinant of health, as our CEO Greg Strahan reported earlier. This is something that Tri-State Food Bank is working with all our community partners on, and in truly getting the food to the people who need it most. So I'm pleased to be a partner with Tri-State Food Bank. In addition, Owensboro Health has other partnerships such as SOS International, Supplies Overseas. It's a hospital recycling partnership. Funding supports continued hospital recycling partnership to help support the expenses related to collection and redistribution of surplus medical supplies. Supplies Overseas was actually a key partner in addressing needs presented by COVID-19 throughout Kentucky, as that was an area of need that they met additional PPE needs and other support. So that is a partnership that we are very proud of. You know, in addition to our Community Health Grant Investment Program, as I was saying, our marketing department works closely with many of our community organizations in their sponsorships as well. So as Greg and Steve had shared with you before, we are working diligently to partner with community organizations in a variety of ways, to give back to the community through our OH Gives and our Owensboro Health Foundation. In numerous other ways that aren't reported today in the community health and grant investments. But the key to this is we've got to meet our mission to heal the sick and improve the health of the communities we serve. So whether it's a grantee or a community partner or a sponsorship by marketing or in any other of the many ways that we are working together with you, we are all in this together. And I would just encourage you to continue to do what you do and be that light, as we talked about, for our communities and our state and for each other. Thank you.